Good afternoon, dear students. Today we continue our medical helminthology lecture, and on previous lecture we have discussed with you phylum Platyhelminthes. You learned about basic and most common representatives, and today we discuss phylum Nemathelminthes and class Nematoda, which is translated like proper roundworms in English language. If phylum Platyhelminthes representatives are quite rare nowadays, and apart of schistosomas, most of them are eliminated. Phylum Nemathelminthes has very big significance in the modern world. So, let's see some basic information about this phylum. Roundworms or nematodes are a group of invertebrates with long cylindrical bodies which are round in cross-section. Most roundworms' eggs or larvae are found in the soil and can be picked up on hands and transferred to the mouth or can enter directly through the skin. Nematodes are almost unbelievably abundant. A number of described species is around 12,000. But too little attention has been paid to these animals, and the true number may be close up to 500,000. Many nematodes are free-living and play a critical ecological role as decomposers and predators on microorganisms. And, of course, nematodes also include parasitic species, a number of which can affect humans directly or indirectly through their domestic animals. Some thrive as parasites in the most tissues of plants and body fluids and tissues of animals. Most species are serious agricultural pests which attack trees. And of course, many nematodes parasite humans and animals, like hookworms attached to intestine and suck blood. Heartworms can be spread by mosquitoes, and many of them are deadly and infections to people, of course. Most distributed nematodes in the world are Ascaris lumbricoides, which is distributed worldwide, and approximately more than 1.5 million of people in the world are infected by this parasite. Second place goes to Ancylostoma duodenale and Necator americanus, which we call hookworms. Approximately 1,003,000 people, 300,000 people are affected in the worldwide, mostly in developing countries. Third place goes to Trichuris trichura, approximately 1 million cases in the world. Fourth place goes to Dracunculus medinensis, approximately 800,000 people in sub-Saharan Africa and Yemen countries. Fifth place goes to Strongyloides cercoralis, approximately 70,000 cases worldwide, which are common for countries with warm climate. Sixth place goes to Wuchereria bancrofti, Brugia malai, and Onchocerca volvulus, which are common in Asia, South America, Sub-Saharan Africa, Western Pacific countries. Okay, so let's see what is the morphology of class Nematoda. Why do we call them roundworms? So, roundworms are cylindrical and slender because they have pseudocoelom, primary body cavity, which is filled up by toxic fluid, and the pressure which is given by toxic fluid gives them cylindrical shape. So this fluid gives them function of hydroskeleton. They are bilaterally symmetrical and sex differentiated, and also you can observe sexual dimorphism. That means female is different, much more larger usually than the male one. Their supporting body wall is quite compound and consists of cortical layer, syncytial layer, that means there is no wall between cell nuclei, and longitudinal muscular layer, which allows these parasites to move actively. These parasites can move actively in human body, in tissues, in intestine, and of course their larvae are movable outside and can travel large distances in the soil, for example, if we talk about hookworms. What is different from platyhelminthes, apart of pseudocoelom, that they have alimentary tract which looks like a simple tube, and this simple tube has three parts and has opening with mouth and ends with anus. And like phylum Platyhelminthes, they lack circulatory system and they lack respiratory system. Nervous system is simple with two nerve cords, a main ventral nerve cord and a smaller dorsal nerve cord. Circulation, they do not have heart or formal blood vessels. Respiration, they have no formal respiratory system. Excretion, roundworms have anus at its area and a series of excretory tubes and with an excretory pore. And what makes them different from phylum Platyhelminthes is that nematodes do not have flame cells. And of course, these parasites are extremely fertile. They are always dioecious. They are never hermaphrodites like Platyhelminthes. And males are usually shorter than females and often have characteristically bent tail for holding the female for population. And female roundworms usually have double uterus, and they are extremely fertile, and in average they can lay up to 100,000 eggs up to 300,000 eggs per day. An infection which is caused by roundworms is called nematodosis. As with other parasitic diseases, roundworms infections are more common in warm countries than in cooler temperature areas. Many nematodoses result from human carelessness and the lack of appropriate personal hygiene and sanitation measures. Most roundworm eggs or larvae are found in the soil and can be picked up on the hands and transferred to the mouth per oral way. As infection occurs variously by eating uncooked meat with larvae, for example with trichinosis, by entrance into unprotected cuts or directly through the skin percutaneous way by hookworms. Also, nematodes can enter by blood-sucking insects, transmissive inoculative way, and so on. Thus, the best solution to the problem rests in preventing these infections rather than in curing them. Depending on the features of the life cycle, helminthic parasites can be classified as followed. They can be geohelminths, which develop without alternation of the host, and the part of their life cycle passes in the soil. For example, Ascaris lumbricoides, Toxocara, pinworm, Trichura species, hookworms. So, transmission to a new host can be done by ingestion of the mature infected eggs or by penetration of the skin or mucous membrane by larvae. And we also have biohelminths, which develop with alteration of the host, and they have intermediate hosts, and transmission to the new definite host is done by arthropod, the vector, and this is very typical. Transmissive way is typical for filariform larvae of Wuchereria bancrofti, Onchocerca volvulus, Loa, and Brugia malaya. There's parasites which we call filarias. And sometimes we can also determine contact helminths, in which all stages of parasite development pass in human organisms with direct contact with patients, and host may occur by physical contact through the hand grip or indirectly by contaminated objects through the pencil, toys, etc. For example, pinworm, Anterobus vermicularis. But because the pinworm comes out of the human body, on skin surface, we still count it as geohelminth. So again, according to the life cycle, we segregate the nematodes into geohelminths without intermediate host and biohelminths with intermediate host. Intermediate host is arthropod, mosquito or fly. Nematodes which infect human might be divided into intestinal, tissue and blood nematodes. So let's begin from intestinal nematodes. These do not require an intermediate host, and infection being direct from host to host after a period of free living existence. So here is the scheme which illustrates the life cycle of intestinal nematodes. All of them produce eggs. If you ingest mature egg through the soil by dirty fruits, vegetables, water, sometimes hands, you can be infected by Ascaris and by Trichuris and Anterobus. So soil can be polluted by eggs of Ascaris and Trichuris, and toys, hands, pencils of children can be polluted by the eggs of Anterobus. After eggs are ingested, Ascaris larvae enter bloodstream, pass through the lungs, become swallowed, and after migration they settle in the small intestine. Anterobus and Trichurus ovipom, they develop straight away in the intestine without any migration. And sometimes larvae can hatch from eggs in the soil, like in free living forms, and these larvae can penetrate through the skin directly when people walk barefoot or sit on the warm polluted soil. It is very typical for hookworms and strongyloides. By the way, you can get infected by hookworms also by eating non-hatched eggs. So let's begin our narration from the most common and cosmopolitan nematoda, which is called Ascaris lumbricoides, human Ascaris. So I will remind you classification of parasite. So it belongs to kingdom Animalia, animals, subkingdom Metazoa, multicellular animals, phylum Nemathelminths, class Nematoda, and species Ascaris lumbricoides. So epidemiology of this parasite is very impressive. The annual global morbidity due to Ascaris infection, ascariasis, is estimated approximately at 1 billion, with a mortality of 220,000 people in the world per year. Ascariasis can occur at all ages, but it is more prevalent in the 5 to 9 years age groups. The incidence is high in the poor rural populations, but among adult people, ascariasis is also very common. The morphology of parasite is that average female worm measures from 20 to 40 centimeters in length, so they're quite large, largest of human intestinal roundworm parasite, and width is approximately 3 to 5 millimeters, so diameter is 3 to 5 millimeters. The male is smaller than female. It makes approximately 20 centimeters maximum. What is typical for male, that it is it has curved posterior end, and the female is straight. The color of this parasite is pinkish creamy, and what is very typical for female, that it has double set of genitalia. Here you can see here double uterus, which is filled up with eggs. And if you will see cross section, there is a typical morphology of nematode parasite. You can see pseudocell, primary body cavity. You can see cuticle. You can see muscles. The parasite is very movable. Ascaris moves all its life and it lives for approximately 1 year in small intestine, and whole life it moves to the esophagus direction. And this excessive mobility of Ascaris gives us lots of trouble and gives us various symptoms of this disease. So you can see oviduct, ovaries, muscle cells, and parenchymal tissue. The mouth of Ascaris is quite interesting. It opens with 3 lips, and the margin of each lip is lined with kind of cutting plates, kind of teeth-like plates, which are not visible at usual light microscope. You can see them only in electron microscope. Okay. So life cycle. By life cycle, again, I repeat, it is geohelminth, one of the most common in the world, the geohelminth. Life cycle is interesting and complicated, and if you will learn life cycle, if you will understand the stages of life cycle, you will understand the clinical symptomatics. You will understand why ascariasis goes in such a way, why the symptoms appear. So if you know what parasite does, you will know where symptoms comes from. It is called clinical thinking. You need to understand that symptoms, they don't come in the patient with no reason. There is a reason behind every symptom which you need to find out. Okay, so infection occurs by ingestion of food contaminated with infective eggs, which hatch in the upper of the small intestine. The larva, which approximately 250 microns in size, penetrates the intestinal wall and enters the venules of lymphatics or lymphatic vessels. The larva passes through the liver, heart, and lungs to reach alveoli and stays in alveoli approximately 7 days. In this period, these larvae grow to 1.5 centimeter. Later, larvae migrate up to the bronchi, ascend the trachea to the epiglottis, and if the sputum with them is coughed out, goes to the mouth, you swallow them, they have chance to pass down in esophagus to small intestine, where they mature in 2 to 3 months. A female may live in intestine for 12 to 18 months, and it has a capacity of producing up to 25 million eggs at an average daily output of 200,000 eggs a day. So these eggs are excreted from intestine, they go in feces, and under suitable conditions they require 21 to 30 degrees moist aerated environment. Infected larvae are formed within an egg. The eggs have very thick shell, very thick protection, and they are very resistant to chemical disinfectants. They are resistant to drought, they are resistant to cold temperature, and they can survive in sewage for months. Only way to kill them is heating them up, and heating regimen should be 40 centigrades for 15 hours. Their source of infection is infected human, and auto-infection here cannot occur. So again, please listen very carefully and try to understand the life cycle of Ascaris lumbricoides. Eggs need to go to the soil. Only in the soil eggs become mature. If you eat fresh egg which has just passed out of the feces of human, you will not become infected. It will be transit egg. So if the egg from feces of human goes to the soil, when, for example, human do not have proper canalization, when farmers use feces for fertilization of fruits, vegetables, etc., these eggs maturate in soil for 3 weeks up to 6 months, depends on the temperature and humidity. So in summer they maturate faster, in winter more slowly, and inside of these eggs rhabdidiform larva should be formed. Egg has 11 layers of protein coat, and this thick protein cover allows them to survive in the soil for 10-11 years. So parasite produces huge amount of eggs, and of course these eggs can wait huge amount of period in the soil for the host. And not only dirty fruits, vegetables, hands can be source of infection, but also polluted water. Rain can wash these eggs to the water sources, and people who drink unheated, unfiltered water can be also infected by this way. So after human ingests such eggs with rhabdidiform larva, this larva hatches out in the small intestine, penetrates the wall, goes to the lungs. The migration goes through the liver and through the heart. Worms do not stuck in these organs, they want to go to lungs, but sometimes during surgery you can note this parasite during migration. It looks quite impressive. They go to the lungs because they need oxygen for maturation. And after maturation, they turn into filariform larva. Filariform larva irritates bronchi, causes formation of sputum. Sputum goes in the mouth. And most of sputum we swallow during night period. So their swallowed sputum with larvae has a chance to return back in small intestine, and if this happens, the parasites become mature and live for 1 year. They move in the small intestine, they irritate the walls of intestine, they produce toxins, yes, they do excretion, they cause allergy, and sometimes if the number of these parasites can be big, can be up to 20, 60, yes, so depends on the amount of infected eggs which were ingested by human. These parasites can cause obstruction of the wall of the lumen, of intestine. They can cause appendicitis because sometimes they can stuck in appendix, and there are cases when these parasites cause jaundice, and even were found in ovaries. So symptomatics of ascariasis depends on the number of parasites which are present in human body. The symptoms of ascariasis is classified into 3 stages. So first stage of ascariasis is migratory stage, when lavas travel from intestine to the lungs. This stage usually does not have any vivid manifestations apart of some allergic reactions. Then we have pulmonary stage, when lavas stay in the lungs, and sometimes if the number of parasites is large, this stage can resemble pneumonia. And what is interesting for this pneumonia, that it ends up spontaneously after 7 days. Or sometimes the persistence in the lungs can cause bronchial asthma attacks, because parasites cause allergy. But again, if the number of parasites is 2 to 4, symptoms might be very mild. If we have 6, 10, 20, of course, symptomatics will be more vivid. And after pulmonary stage, after 1-2 months, we have abdominal stage, which is manifested by abdominal cramps, especially hunger cramps. When you didn't eat food, the parasite will remind you to eat this food. By diarrhea, by skin rash, by nausea and vomiting, headaches, fatigue, etc. And diagnostics of the parasite is not very complicated. Most of parasites, especially in children, become eliminated during nausea and vomiting, or you can find dead parasites in stool during diarrhea. So very often diagnostics is done by patients themselves when they find dead parasites, or sometimes parasites can be still alive in emetic masses or in stool. And clinical diagnostics is done by 2 ways: by ovohelmintoscopy, finding eggs in feces. I remind you that eggs can be mature and immature, fertilized and fertilized. This is fertilized egg. You can see embryo inside. It is embryonated, so it's fertilized, and you can see very thick protein cover, which gives very good protection in the outer environment. And of course, serological methods. Serum means blood plasma without calcium, and these parasites cause immune response. They have antigens, yes, the foreign proteins, and to these antigens we show our response by immunoglobulins, protective proteins, which we also call antibodies. So finding antibodies to the ascaris is a common serological test which is present in every laboratory. So it's not exotic, it's quite routine tests. And again, I repeat, diagnostics is ovohelmintoscopy and serology. And one more, if we suspect pulmonary stage, we need to do microscopy of sputum. So larvoscopy of sputum is also additional method when we suspect pneumonia, and we sometimes can find that lavas of ascaris were the reason, causative agent of this pneumonia. So again, diagnostics is ovohelmintoscopy, is larvoscopy, and serology. Treatment of ascaris is not very complicated. The only precaution should be done that if we have big amount of parasite, they can get stuck inside of human body. So in young children, treatment should be done with precaution and care. Prevention of ascariasis is extremely important, and it should be public. So government needs to take measures, and personal means you also need to take measures and protect yourself. Actually, you study medical biology, and this part of medical biology, medical helmintology, in order to protect yourself and your family. So in the first course you can get basic skills which will help to prevent big trouble for you in future. So listen carefully and remember, it's not very complicated. So public should be sanitary disposal of feces, Farmers should not use human feces as fertilization. This should be prohibited. So sewage waters should be removed and cleaned. Mechanical vectors like flies and cockroaches should be eliminated from streets and human houses because eggs can attach to them. And of course, propaganda and health education should be done. So people need to know what is ascariasis and how to prevent it. Personal prevention is making out stronger hygienic habits, such as cleaning hands before meals and washing carefully all fruits and vegetables which were growing in the soil, like carrots, cabbages, or which were fertilized, or which just dropped on the soil from a tree which had contact with the surface of the soil. So, and of course, water should be boiled and filtered. If you done such simple measures, the ascaris will be controlled. So when you will come, for example, to Crimea, and we will have springtime when we have lots of fruits growing after winter in our country. When you see strawberries, you should wash them very carefully, because in our country strawberries are the most polluted berries which can be source of ascariasis. So when you enjoy fruits which grew near the surface of the soil like strawberries, you should wash them very carefully. Okay, I hope you will understand this information and not become exposed to ascariasis. Next parasite, which is extremely common and which affects mainly children, but adult people can be sometimes affected by pinworms, especially if they live in hostels or even in prisons. So pinworm, Latin name of pinworm is Anterobus vermicularis. Pinworm is the most common roundworm parasite in temperate climates, and it's a common even in countries with a high level of sanitation. In Russia, it is number one nematode after ascaris. And you can see that it is common in US in children, and of course in India you can also meet this parasite. In the worldwide, we can count approximately 210 million people affected. It's an urban disease of children, especially in crowded environment. It can be seen in orphanages, schools, daycare centers, kindergartens. Adults may get it from children. Morphology. The female worm measures just approximately 1 centimeter in length. The width, the diameter of the parasite is 0.5 millimeter, and a female is smaller. It is curved, so female is usually S-shaped and male is spiral shaped, and it is much smaller and makes approximately half a centimeter. Eggs of these parasites are microscopic, like in ascaris. Color of these parasites is white. Eggs are translucent, asymmetrical, and the size of eggs is approximately 60 by 27 micrometers. So egg is translucent, microscopic, and asymmetrical. So one side is ovoid and another side is flat. Inside you can see forming larva. So what is typical for Anterobus, that they have bulbous, specific part of esophagus which helps them to attach to the mucosa of intestine. So these parasites live in the large intestine, usually in the upper areas of large intestine. Sometimes they can be found in the ampulla of rectum. Infection occurs when embryonated eggs are ingested from the environment with food or by hand-to-mouth contact. So again, it's very common for children. The embryonic larva hatches out in the duodenum and reaches adolescence in the jejunum and upper ileum. Adult worms descend in the lower ileum, cecum, and colon and live there for 7 to 8 weeks. The gravid female, which contains more than 10,000 eggs, migrate at night to the perianal region and deposit their eggs there. So every night, gravid female comes out of the large intestine and lays the eggs in the perianal region. Moist warm skin. The eggs mature in oxygenated moist environment and become infections in 3 to 4 hours, sometimes 6 hours later after hatching. And human to human is very common. You can also observe here auto-infection, and human is the only host. So in Ascaris, in Anterobus, in Trichocephalus, which we'll discuss later, only humans are hosts of these parasites. So if you treat humans, if you control humans, you will control these diseases. So again, gravid female every night travels to perianal region. Usually it dies there, and eggs become invasive after 4 to 6 hours, usually by morning. And what does it mean become invasive? That means larva is formed inside of these eggs. How reinfection happens? Movement of female Ascaris or Enterobus to the perianal region causes itchiness, and children who have enterobiasis, they itch, scratch the perianal region. When they scratch perianal region, the mature eggs go under their nails, and children pull these hands in the mouth. So eggs become swallowed, and then larvae hatch out in the duodenum, and the cycle become completed. And children spread these eggs by playing with another children, by sharing toys, and sometimes even underwear. So the main symptom of enterobiasis is intense rectal itching or pruritus ani. So all the time children try to scratch this perianal area, and if it is found in girls, you can also observe in them vulvitis, inflammation of vagina, because sometimes Enterobus can go even there. And the parasite is short-living. It lives only for 30 days. Due to auto-infection, children can be sick for many years till they grow big enough for forming necessary hygienic skills. Apart of intense rectal itching, children become irritated. They have disturbance of sleep. You can see bedwetting, loss of appetite, allergic reactions. Diagnostics. The eggs of Enterobus never found in stool, because Enterobus does not lay eggs in intestine. So sometimes in stool you can observe dead Enterobus, dead female Enterobus, but it is quite rare. So if you see typical symptoms, if your child goes to kindergarten or junior school and become itchy in the perineal region, has bad sleep, cringe of teeth, etc., you need to do test by attaching of transparent tape pressed to perineal region, and so-called perineal swabs and swabs from the nails. You need to study the nail content. So Enterobus test is not done by stool examination. Again, finding female Enterobus in stool is quite rare. So it's better to do test tape by pressing the sticky tape to perineal area and then on slide. And sometimes we can also study the content, the dirt from the nails. And serology method is also applied. Treatment is similar to ascariasis, but because of possibility of auto-infection, children should maintain very strict hygiene for 1 month. And if you have young child and if you have strict hygiene maintenance for 1 month, this pinworm disease, this enterobiasis, can disappear after 1 month without any drugs. So treatment of enterobiasis can be done without drugs, because parasite is short-living. So to maintain strong hygiene, the child needs to be changed the underwear every day. The underwear of young children should be ironed with hot iron. And for the night, to prevent itching, to prevent touching the infected area, you need to put gloves on hands. Nails should be short, and tight pants should be put on the night, during the night period, and after night period the underwear should be changed. Once in a half a year, children who attend kindergarten should be examined for enterobiasis in all countries. And if your child has enterobiasis, you need to inform the teacher or nurse of the school or kindergarten that all children should be examined and all toys should be cleaned, because reinfection is quick, and again child will require help. So next parasite is much more dangerous. It is quite common in US, and it is called trichuria or whipworm. Whipworm is very dangerous parasite because it is blood-sucking parasite. If Ascaris or Enterobus eat mainly our foodstuff or fecal materia, this one is hematophagous. Trichuris eats blood from intestine villi. So morphology of this parasite is quite interesting. Adult female makes 5 to 6 centimeters in length, and male is approximately 4 centimeters. Why it's called whipworm? Because head and anterior end, where mouth is present, looks like hair. Trichos means hair. Sometimes we can also call this parasite Trichocephalus trichurus. Trichocephalus, trichos hair, cephalus head. Yes, you can see why it's called so. And the eggs of this parasite are typical for geohelminth, similar to ascaris. They have thick protein coat. They are brown in color, and what makes them typical, they are barrel shaped or lemon shaped with plug-like poles at each end. These plug-like poles maintain specific osmotic pressure inside these eggs, and the size is 20-50 microns in their length. So again, you can see the difference between male and female sexual dimorphism. The female is much more larger, and this is the head end, anterior end. There is a mouth, and in this anterior end we have nervous system and esophagus, which goes in intestine. All reproductive organs are located in the posterior end. Why this parasite has such interesting morphology? Because this hair and this thin end goes like catheter inside of capillary, which is present in intestinal villi. So it goes like syringe, it goes like catheter inside of blood vessel and sucks blood. It requires fresh blood. This is the actual size of this parasite. Yeah, it doesn't look big, but if we have severe infestation, if the number of parasites is large in human intestine, they cause severe anemia. And one more thing which causes severe anemia, that these parasites are long living. They live up to 5-6 years, and all these 5-6 years they suck human blood. So people become infected by ingestion of polluted foods and water, polluted by eggs which are present in the soil, and symptoms can be quite severe, starting from allergic reactions, from abdominal pain, from anemia, from and can end up with diarrhea, and even perforation of intestine. And of course, secondary infection also joins the affected mucosa. Diagnosis is quite simple, is again stool examination, again overhead microscopy, and again serology. So this parasite is quite dangerous because it requires fresh human blood and sucks this blood for 5 years and more. Another intestinal parasites, which are number 2 among all parasites about all nematodes in the world, are hookworms. 2 major species of hookworms which can affect human. This is Necator americanus and Ancylostoma duodenale. These parasites have similar morphology, that's why we call them hookworms. So these parasites are bend, their anterior end is bent like hook. They inhabit small intestine. Ancylostoma duodenale is common in southern Europe, North Africa, northern China, in India, and is considered to be a more pathogenic one. The Necator americanus is predominant species in the Western Hemisphere and Equatorial Africa. In China, India, this parasite also present. So Ancylostoma duodenale female is approximately 1 centimeter in length, and males approximately 8-10 millimeter in length. In posterior end, they have umbrella shaped bursa with red-black rays for copulation, and in both parasites, anterior end contains mouth capsula with cutting plates. You can see that Ancylostoma duodenale has 4 cutting plates for cutting the duodenal mucosa. This parasite also is hematophagous. It is blood-eating parasite which requires fresh blood, and to obtain it, it doesn't go inside of the vessel like trichocephalus. It cuts the villi and it causes severe hemorrhage, so blood directly pours into its mouth. And you can see that it is bent like hook, so that's why these parasites are called hookworms. In the mouth capsula, if you look carefully, you can see 2 foramens, 2 openings of glands. These glands produce anticoagulative factor, so these parasites prevent blood from clotting. That makes them even more pathogenic to human. Necator americanus is smaller than Ancylostoma duodenale. It is less aggressive and it is more longer living. If Ancylostoma duodenale lives for approximately 5 years, and Necator can live for 6, 7, 8 years sometimes. And mouth capsula is different from Ancylostoma because it has 2 cutting plates, only 2 cutting plates. Eggs of these parasites are very similar. You cannot distinguish them from one another. So they are oval shaped, thin with thin hyaline shell, and inside of these eggs you can see blastomeres. So these eggs have blastomeres inside. Life cycle of hookworms is very interesting. Eggs are eliminated with stool to wet, moist soil. In wet, moist soil, after 1 or 2 days, if the temperature is high, rhabdidiform larva hatches out. In 1 or 2 days, it turns into filariform larva. Difference is in size and in the structure of esophagus. Rhabdidiform larva is non-invasive, and filariform larva is invasive one. So people who are miners, who are gardeners, farmers, road builders, people who just live in slums, who work bare feet, who don't have proper sanitary disposal of fecal materials, are in the risk area. Filariform larvae have hemotaxis. They sense when people stand or sit, they feel human body, and they are so aggressive that they can even go through their thin fabrics. So of course they can go through the bare skin, but if people wear trousers, they can rise up on the grass and penetrate through the ankle. Even fabrics, even clothes, thin clothes doesn't stop them. So these parasites are extremely aggressive. And sometimes people can also become infected, like in ascaris, if they eat eggs of these parasites in dirty foods and water polluted by soil material. Life cycle in human body also goes with migration. So if parasites enter through the skin, they need to go to the intestine somehow. Yes, how to go from skin to intestine? They need to go through the heart to the lungs, cause pneumonitis. Multiple pneumonitis is also known as Lafleur syndrome, can be quite severe, and by causing sputum production, same as ascaris, they travel back to intestine, where they bite mucosa and stay there for 5 years for celestoma or more if it is Nicator. If human eats the eggs, the life cycle goes without migration. So symptoms which are done by hookworms, and the symptoms may recognize this infection as early as possible, because early recognition, early diagnosis can save sometimes human life. These parasites can be deadly. Longer they live, the worse is prognosis for life. Hookworm larvae cause dermatitis. So when they penetrate through the skin, they cause dermatitis. Itching, which is known as ground itch or dew itch. So you can see that something went through the skin. And actually these parasites, larva migrants, when they enter through the skin, is not only typical for hookworms, it is common for other species like Toxocara canis. And when tourists travel to hot countries, walk on the beach, step on dog feces, they can also have these larva migrants. So it's quite common. Pulmonary inflammation, and later abdominal pains, diarrhea, loss of appetite, hunger pains. Parasite damage mucosa and cause ulcer. And later these parasites, especially big amount, causes anemia, iron deficiency. These parasites suck the blood. And one more thing, as I told you, they bite mucosa and they release the factor which prevents blood clotting, anticoagulative factor. And many blood is just lost because these parasites cause profuse bleeding. Blood cannot clot, and the parasite doesn't hang on mucosa only 5 years on one place. These parasites are able to migrate along the lining of mucosa, change their position, and after they change their position for many hours, they remain, after them is remained bleeding place. So they cause massive bleeding. The typical symptom which accompanies severe anemia is called allotriophagy or geophagy. So this is the symptom when people eat non-edible products, non-edible things. So when people have such severe anemia, so they eat rocks, sand, glass, sometimes soil. So soil eating. And severe anemia and long manifestation of these parasites in human body can be deadly. Very often people who have massive infection, they die. And even if you remove these parasites, still they can die from ulcer, and still they can die from anemia. And eating soil is also very, very dangerous for health. Okay, so diagnostics is geographical anamnesis. travel into countries where hookworms are common. Skin examination, you can see larva migrants traces, you can see dermatitis, yeah, dew itchiness. Brine flotation, checking for eggs with blastomeres, serology, and sometimes we can do hookworm larva cultivation. So hookworm larvas have bright color, and if we suspect hookworm infection and didn't found eggs, which is not so simple, we can leave feces for some period, and if hookworms are present, we can see reddish larvas which are present in feces. And like in nascaris, we can find hook larvas in sputum. So protection of these parasites is very important, and of course government should do public protection, and you yourself should not forget about personal protection, because for India hookworms are very common due to climate and poor sanitation in some areas. So first of all, protection is proper fecal disposal. So fecal matter should be disposed in toilets with concrete walls, that larvae do not go in the soil. Miners should have proper toilets and work in proper clothes. They should use rubber boots with which cover their ankles. And when you enter in some areas where hookworms are common, you should wear good ankle boots to protect yourself from these parasites. And if you noticed larva migrants in your skin, straight away go to doctor. Don't wait till you have duodenitis, ulcer, or anemia, because these symptoms are extremely dangerous. Okay, and the last geohelminth, which we discussed in lecture. Please don't think that these are all parasites which exist. No, their number is huge. We cannot discuss them all. It will require a huge amount of time, so you can read literature about helminthology. And this last geohelminth is Strongyloides stercoralis, or thread worm. Strongyloides stercoralis is found in the same areas, in same group risks as hookworms, but it can be also observed in the mines in countries with moderate climate, such as Russia, such as Ukraine. Adult parasite is 2 millimeters, very small, that's why it's called threadworm, and it is facultative parasite. Remember what is facultative parasite, which we discussed with you in class? Facultative parasite can have free living cycle. So eggs of this parasite is passed in feces in soil. Larva develops in the soil, and if conditions are favorable, this parasite lives as free living animal without affecting human. But if conditions in the soil deteriorate, become non-comfortable for parasite, it becomes invasive form, and again it penetrates through the skin, goes through heart into lungs, and sometimes even in lungs these parasites can become mature. Adults reach the intestine, they live in small intestine, and the main danger of this parasite that they can cause hyperinfection. They do not suck blood, they do not block the lumen of intestine, but they develop very quickly. They lay eggs, and these eggs hatch just in 3 days. 3 days is the passage of food through our intestine. So when feces are leaving the intestine, the larvae can be already found in stool in rectum, and during defecation the larvae can already penetrate in the skin. Again they go in the heart, again they go in the lungs, bringing all infection from our intestine, and the cycle starts over and over. So once people become infected, the number of these parasites can reach thousands and even millions. And this is called hyperinfection. If it is not treated in time, it causes AIDS-like symptoms, and people die from immunity failure, from blood contamination. Prevention is same as hookworms, proper human fecal disposal, examination of people who work with soil, proper toilets and protective clothes. And mines where people work, the soil in mines should be decontaminated. Special chemicals should be applied to decontaminate the soil. And of course, people who have risk, they should have checkup. And the diagnostic criteria is serology and finding larvae in stool. If in hookworms larvae are found quite rarely, only if people have constipation. Here eggs in stool are not found and larvae are found because larvae hatch out extremely quickly. Now we go to tissue and blood nematodes. Tissue and blood nematodes are biohelminth, and they require intermediate host, which is usually arthropod, but not always. These parasites, which are biohelminths, belong to species of Trichinella spiralis, Dracunculus medinensis or Guinea worm, and Filaria. So, filarias are very common tropical vector-borne helminthiasis. Yes, vectors do not only transmit protozoan parasites, they can also transmit helminths. So filarias are common name for diseases which are found in tropical countries, which causes lymph-dwelling manifestations, which have slow development and long incubational period. And the main reason of these diseases, of these pathogenic changes in human body, are larvae. So filarial worms include Wuchereria bancrofti, which causes lymphatic filariasis. Adults are found in large lymphatic vessels and microfilaria found in blood. Loa or African eyeworm, adults are found in subcutaneous and some conjunctival tissues, causing calabash wheals, and microfilaria again are found in blood. Onchocerca volvulus, adults are found in subcutaneous swellings, microfilaria mainly in skin, eyes, causing river blindness. And one more parasite which is not mentioned here. This parasite is Brugia malayi. So most common parasite out of them all is Wuchereria bancrofti, which causes lymphatic filariasis or lymphangitis. Wuchereria bancrofti is strictly a human pathogen and it is distributed in tropical areas. Mosquitoes are the vectors of this parasite. Which mosquitoes? Culex species, which is common in urban and semi-urban areas. Anopheles mosquitoes, which is common in rural Africa, and Aedes, which is common in Pacific Islands. Wuchereria bancrofti and very similar species, which is called Brugia malayi, are very similar in morphology. And adult female Wuchereria bancrofti is found in lymph nodes and lymphatic vessels, which makes approximately 10 to 15 centimeters in length, and males are only half of that size. Larvae, microscopical larvae, which are called microfilaria, are found in blood, and they are very small. They make approximately 260 by 10 micrometers. Adult Brugia malayi are only half of the size of Wuchereria bancrofti, but their microfilaria are only slightly smaller than Wuchereria. Life cycle. So these parasites are biohelminths. Filariform larvae enter the human body during a mosquito bite and migrate to various tissues. There they may take up to a year to mature and produce microfilaria, which migrate to lymphatics and at night enter the blood circulation. Mosquitoes are infected during a blood meal. The microfilaria grow 2 to 4-fold in the mosquitoes in 2 to 14 days and become infected to human. Symptoms include lymphadenitis and recurrent high fever every 8 to 10 weeks, which lasts from 3 to 7 days. The recurrent fever is the main symptom of incubational period. So before this enormous lymph swelling or elephantiasis, leg like an elephant, starts to develop, the incubational period with the recurrent fever is very, very typical. And for Wuchereria bancrofti, it lasts for approximately 1 year. Before lymphadenitis, and for Brugia malayi, it can be even more longer, up to 2-3 years sometimes. After incubational period, there is development of progressive lymphadenitis due to an inflammatory response to the parasite lodged in the lymphatic vessels and tissues. As the worm dies, the reaction continues and produces a fibroproliferative granuloma, which obstructs lymph channels and causes lymphedema and elephantiasis. The stretched skin is susceptible to traumatic injury and infections. Microfilaria cause eosinophilia and sometimes splenomegaly. Prognosis in the absence of elephantiasis is good, but if severe elephantiasis develops, only way to treat it is amputation. So the difference in clinical symptoms between Wuchereria and Brugia, that Wuchereria usually causes lymphatiasis of one leg, Brugia causes elephantiasis of 2 legs, and also Brugia causes elephantiasis on arms. So after incubational period, after fever, people start to notice that the extremity and sometimes scrotum in men starts to become swollen. You know that we have tissue fluid, and some of this tissue fluid has to be drained from our extremities, from our organs, and form lymphs. So every day lymph goes from tissues to the ductus lymphaticus, where it becomes cleaned from waste materials and from pathogenic agents. So lymph is produced every day, but microfilaria cause inflammation they die inside of these lymphatic vessels, which are very, very thin, and around that parasites is produced connective tissue, which blocks the lymph passage back to ductus thoracicus. The accumulation of lymph makes the extremity swollen, and it becomes bigger and bigger and bigger, and sometimes the size of infected extremity was recorded up to 30 kilograms. So it resembles elephant leg. So all what you see is a giant edema. And if you didn't see this, if you missed this disease at early stages, if you didn't do treatment before the multiple microfilaria which are born inside of human body by adults and all the time enter these lymphatic vessels, if you didn't kill adults in time, the lymphatesis will go in progress, the tissues will squeeze the blood vessels, and it will lead to necrosis. So people walk with such leg approximately 8-7 years, and when it becomes too massive, the only way to get some help is to amputate this extremity. So this disease is very scary. Surgery is possible, but nowadays it's mostly experimental, and it doesn't give 100% effect. So this is necrosis in the end stage. So of course such extremity should be only amputated. Diagnostics of this parasite is based on a history of mosquito bites in endemic areas and clinical findings and presence of microfilaria in the blood samples collected at the night time. So at night time the larvae are hidden deeply in the tissues in lymphatic vessels, but at night they come to peripheral blood. This is nocturnal smear, because these larvae they need to go in the organism of intermediate host. It needs to go to mosquito muscles, and mosquitoes, as you know, are active only in the night time and before dawn. So at night we do sometimes up to 6 smears to catch these larvae in their blood. So people who are suspected wuchereresis or brugiasis are placed in the hospital for approximately 1 week, and every night we take few blood samples to catch up these larvae. And if we do so, we need to start treatment immediately before these parasites turned into adults and start to produce larvae which will block their lymphatic vessels, causing elephantiasis. Another filariasis, which is causing river blindness, and it is called onchocerca volvulus, which causes onchocerciasis. Onchocerca volvulus is also a filarian parasite, is prevalent throughout eastern, central and western Africa, where it is the major cause of blindness, and this disease is confined to neighborhoods of low elevation with rapidly flowing small streams where black flies of simulium are found. Human is only host, so only final host. So if in Wuchereria and Brugia the vector was mosquito, here is black fly, which lives near rivers, and this fly transmit larvae of onchocerca, larva stage 3, by the wound which makes by its bite. Larvae from the skin, then move to subcutaneous tissues, where they become encapsulated within nodules and mature into adults in approximately 1 year. The larvae in the skin create painful onchosarcomas. Adults live in the thoracic duct or in the aorta, like which area is approximately also 15 centimeters, and they give birth to larvae which migrate again to the skin, and again these larvae can go inside of the eyes. Inside of the eyes, the larvae become trapped in the cornea, choroid body, iris, and anterior chambers, leading to photophobia, lacrimation, and blindness. So after a few years, if these parasites will persist in human body, people can become completely blind. At early stages, disease is curable. At late stages, blindness is irreversible. So again, diagnosis is based on symptoms, history of exposure to black flies, and presence of microfilaria in the nodules. Prevention measures include vector control, treatment of infected individuals, and avoidance of black flies. African eyeworm, which also belongs to filaria. Definite host is man. Intermediate host is chrysops or deer fly. Again, the lower is transmitted by subcutaneous bites, which are done by chrysops a day. On the place of bites, you can see very strong allergic reaction, which results in Calabar swelling. Calabar is a place in Nigeria. The swelling is quite painful, and it can reach size of chicken neck due to allergic edema. And larvae live for many years inside of these Calabar swellings. These Calabar swellings can migrate on skin, and again adults live in aorta, thoracic duct, and their larvae migrate in the subcutaneous fiber and go under conjunctiva, causing temporarily vision loss, conjunctivitis, itchiness, redness of eyes, and after some time they disappear. If surgeon will see the larva of lower under conjunctiva, he can carefully try to remove this parasite from the human body. Parasite is long-living, and adults and larvae give huge disturbance to the people. Diagnostics of loiasis is done by finding microfilaria at daytime, because chrysops are active at daytime. Guinea worm. Guinea worm is another parasite which is common in tropical countries. Latin name of guinea worm is Dracunculus medinensis. Dracunculus medinensis is recorded in the Guinness World Book of Records because it is the longest parasite. It is the longest parasite of humans and animals. So here animals are also act as reservoir hosts and help in distribution of this parasite. This parasite is common in tropical countries. In some countries like Uzbekistan it is eliminated, but in India and in Africa, in some areas it is still present. The size of female the size of female is approximately 120 centimeters in length, and the male is just 3 centimeters in length. It is very small. It is very small. Humans become infected by drinking unfiltered water, which contains copepods, small crustaceans, and copepods are infected with the larva of Dracunculus medinensis. Dracunculus means snake, and medinensis means Medina, Arabian city. Following ingestion, the copepods die and release the larvae, which penetrate the host's stomach and intestinal wall. Later, they enter the abdominal cavity and retroperitoneal space. After maturation into adults and copulation, the male worms die and females, which can be up to 1 meter, migrate to the subcutaneous tissues towards the skin surface. Approximately 1 year after infection, the female worm induces a blister of skin, generally on the distal lower extremity, which ruptures. When this lesion comes into contact with water, a contact that the patient seeks to relieve the local discomfort, the female worm emerges and releases larvae. The larvae, again ingested by copepods, and after 2 weeks and 2 molts, develop in the infected larva. Ingestion of these copepods closes the cycle. So people become infected by ingestion of the copepods. Adult growth on the skin causes painful blister, and this blister makes human or animal put the affected extremity in the water. Sometimes it is called burning snake. And the number of these Dracunculus parasites can be big, can be 2, can be 10, can be even more. More human drinks affected water with cyclops, more parasites are present under human skin. And the only way to treat this parasite, which grew up under the skin, is to take a matchstick and wrap it slowly around this matchstick. If you will pull quickly and rupture the parasite under the skin, toxic fluid will cause very severe inflammation. So big parasite need to be extracted within 1 month. People who live in the endemic areas know how to extract this parasite. The only thing they don't know how to prevent the infection. And actually, the prevention of this parasite is very easy. If people will have proper water supply, and copepods will not enter the water, because even when you swim through copepods is enough to infect you. If animals like dogs, monkeys will be controlled and will not distribute this parasite, the parasite will be eliminated from human population. And this was done in some countries like Uzbekistan, where the parasite was completely removed by proper public sanitation and awareness. And of course, this should not happen. The last parasite for today, with the last biohelmet, is Trichinella spiralis. It causes trichinosis. This parasite is distributed worldwide, and especially in the Eastern Europe and West Africa. So the parasite is distributed mostly in the pork-eating countries, including Russia. Nowadays, it's becoming quite rare. So parasite is very small. Adult female makes approximately 3-4 millimeters. Adult male is even smaller, 1.5 millimeter. Encysted larva is only 1 millimeter in size, and it is usually surrounded by fibrosis capsula. Adult worms live in the small intestine, and larvae are located in their striated muscles. Trichinosis is a serious disease in humans and other animals, including pigs, cats, dogs, bears, foxes, and rats. Humans become infected by eating larvae with undercooked pork. Mating takes place in the host's small intestine, after which the fertilized females burrow into intestinal wall and release their larvae. The larvae in turn are transported by the bloodstream or by lymphatic fluid to all parts of the body. The worms grow within the muscle tissue, requiring approximately 16 days to mature. A cyst develops around the larva body. Further development occurs in muscle tissue containing the encysted larva, which can be eaten by appropriate host. So, the pigs become infected when they eat usually rats. And one more thing, even if their pork will be cooked very well, or it will undergo specific freezing regimen, the killing of Trichinella larvae may not happen because the capsula of the larvae is additionally soaked by calcium, which gives it extra protection. If people will eat approximately 10 larvae of Trichinella spiralis, this disease will be deadly for them. So people who eat infected pork, no matter if it's cooked or not, are under high risk. So farmers, people who live in villages, and of course hunters are at risk by infection with trichinosis. So larva causes severe inflammation, which goes from 17 to 30 days, and the inflammation causes the formation of capsula. Larva needs this capsula to stay in human body and to wait for the next host. So human becomes first intermediate host, and later it becomes final host for the Trichinella spiralis. The early symptom of trichinosis is rise of temperature, and usually symptoms start to appear on the third day after eating infected meat. Life cycle goes very quickly, and early symptoms are rise of temperature, skin rash, and edema of upper lids as allergic reaction. Later, people have pain in the affected muscles of tongue, deltoid muscles, pectoral muscles, gastrocnemius muscles, and very dangerous is myocarditis. Larvae can be also located in the heart muscle, causing death. Diagnostics is done by checking food anamnesis and serology, and in some cases we can do biopsy. Prevention of trichinosis is only safe maintenance from pigs, that pigs should not eat decay material, should not eat things on garbages, and sanitary veterinary control of pig meat, of pork. So after pig is killed and the meat is gonna be sold on market, the owner of pigs should make sure that pig meat undergoes veterinary inspection. Veterinary doctor should take some samples from pig meat, do biopsy, and check this pig meat for presence of Trichinella. If trichinella is found, this meat should be burned, should be destroyed. Selling such meat is a crime. So here is a short information, short scheme about helminths, and hope you found helminthology interesting and useful. Thank you for your attention. Write your questions in the chat.